We have to do this classes list today because the ring light is not going to let me shine. Well, it's going to let me shine, but then it will shine off of my glasses. So we have to go glasses list today, but it is Monday, the first Monday of January 2022. I have decided I'm not calling it 2022 because I do not want to live 2020 over again. So, or ever again. So it's in my book, it's 2020 and 2. Again, it's Monday. If you think you can't do it, go ahead and brew yourself a cup of coffee because porque dale que tú puedes. Yes, you can. Coffee says you can make it through this Monday, and we're going to do it. So, hey, Baddie. Welcome to the collective. This video is literally for you. This is going to be the first in a set of introduction videos that kind of just gets all of us acclimated to the space that the BADDIE Collective is curating, the who, what, where, when, why, and how of it all. And today we are going to start with the who and why are we focusing on that who. When we look at the acronym, if you will, BADDIE, right? B-A-D-D, we are dealing with BIPOC, and BIPOC stands for Black and Indigenous Persons of Color. And then the A.D.D, of course, is for Attention Deficit Disorder. That is the major part of this collective. We are focused on females, and I use the word females to include the wide age range of women and girls and teens and young adults and seniors who are being diagnosed, women who are being diagnosed with attention deficit disorder. We're going to go through all of that today. We're going to look at all the different demographics, and then we're going to look at how those demographics play out when they intersect. And literally, today's video is for you. Most of the statistics that are coming to you today are being found from Mental Health America. This is one of the nation's leading nonprofit organizations that is centered around addressing mental health needs and care for Americans. Founded in 1909 by Clifford W. Beards. There is, of course, a national office as well as 200 plus affiliates that are working hard every day to make sure that people with mental health illnesses and conditions are being represented with integrity and dignity, as well as broadening the awareness about neurodivergence to neurotypicals. I'm really excited about the work that they're doing. There is a whole segment on the website mhanational.org that is specifically designed and targeted to addressing BIPOC mental health needs. That is where a lot of this information that I'm going to give to you today comes from again. And they are also kind of on the forefront of for the month of July, which I'm really excited, not just because it's cancer season and it's summer, my favorite season, but also because it is BIPOC Mental Health Awareness Month. So look out for what MHA has in store for July, but also what the BADDIE Collective has in store for July. So when we look at the population of the United States, 41.8% of the population demographically are BIPOC. Again, Black and Indigenous Persons of Color. All right, I'm going to be looking down at my notes for this because I've written down the stats and I want to make sure that I get them to you correctly. So when we look at the Black and African American population in the United States, 17% of Black and African American persons are living with a mental health, illness, and or condition. That's 6.8 million Americans. When we look at the Latina, Latinx, Latino, or Latina community, 15% are living with a mental health illness or condition, and that's 8.9 million people. Asian American and Pacific Islander, 13% are living with a mental health illness or condition, and that equates to about 22 million people. Native and Indigenous persons, 23%. 23% of the Native and Indigenous population is living with a mental health illness, and that equates to some 830,000 people in the United States. And then when we look at people who identify themselves as multiracial or more than one race, 25% of those individuals are living with a mental health illness. I think that says it all, right? Like, I can literally stop the video right here. No, I didn't count it up, but I'm gonna count it up right now. I can literally stop the video right now. No shortage of information, research, and history that shows in the United States, globally as well, that minority populations at a rate that is exponential experience inequities in their social, political, and economic health and well-being in the United States. And one of those things includes health. There are large health inequities, large gaps in health and the disparities within. And so that is one of the reasons why the BADDIE Collective exists, is to be a force of closure in our health disparities and health gaps. When we look at SDOH's social determinants of health are defined as elements and characteristics, factors within somebody's lived environment that literally determine their health and how the quality of health and healthcare that they have. There are 5 social determinants of health: education, access to education and quality education. We have a person's built environment and neighborhood, their economics, of course, healthcare access and quality, and of course, a person's social and community context. Those are the 5 social determinants of health. And if we look at all of those 5 determinants of health, we know that minority people are having grand issues and have experienced and are experiencing, and if we don't do our part, we'll continue to experience disparities and inequities when it comes to not only our health, but just everything that comprises life, especially here in the United States. You can find more information about social determinants of health through Healthy People 2030, the U.S. Department of Health and Human Services, moreover, the Office of Disease Prevention and Health Promotion, oversees the programmatic push for Healthy People 2030, and that is to say that in the next decade, we want to see more healthy people in the United States by specifically attacking and making programs on the federal, state, and local level in order to increase those social determinants of health in a way that increases the health of people in the United States. And the BADDIE Collective is my portion and our portion in trying to assist in that. Now let's go to the other determining factor in the BADDIE Collective: women. And I'm gonna say females, not to trigger anybody, but because when we look at women, especially for this channel, we are not targeting a specific age group, although specific age groups may be drawn to this content. But I'll say females just because I'm targeting 0 to 502, okay? there is such a large range of women, girls, teens, young adults, seniors who are experiencing ADD, ADHD in a lot of different ways, directly or indirectly. And so that is why you'll hear me use the word female. And I needed to put that little disclaimer just to make sure that it's not in any type of like derogatory or triggering fashion, because I know I know the climate around that right now. So when we were looking at that demographic, 50 to 75% of women and girls go undiagnosed with ADD or ADHD. And I see one of the biggest reasons why women are undiagnosed or misdiagnosed when it comes to ADD and ADHD is because when we think of this condition, we think of, I used to think of like, you know, just that hyperactive boy in school that's like jumping off the walls, right? And that is a huge negative and incorrect stereotype of what ADHD looks like. And because that stereotype and that stigma exists, that creates barriers for people who have different types of ADD or ADHD from getting the treatment and the care that they need. So when I say that there are different types of attention deficit hyperactive disorder or attention deficit disorder, there are 3. So ADD, which is attention deficit disorder. You have ADHD, attention deficit hyperactive disorder, and then you have a third type, which is a combination or a hybrid, if you will, of the two. Let's go back to the stat about the 50 to 75% of women going undiagnosed with ADD or ADHD. Go back to that stigma, that stereotype of ADD that I just mentioned, that little boy who's in class and he can't sit still and, you know, whatever. Most women do not experience ADHD. Most women experience ADD, and that is another reason for this intersectionality in the collective. Most women, at almost a rate 60 to 70%, the stats are still out and the research is still out on that, but 60 to 70% of women experience attention deficit disorder, or sometimes it's referred to as inattentive ADHD. And the symptoms for ADHD versus ADD are entirely different, and that is why a lot of women are going underneath the radar. And that radar, what I mean is mental and behavioral health services that are critical to a successful life. So this is why the collective exists, in order to increase the understanding of what inattentive ADD looks like versus ADHD. And also, not to say, I gave the stat earlier, 60 to 70% of women experience inattentive ADD. There are women, there are girls who experience hyperactive attention hyperactive disorder. Attention deficit hyperactive disorder. I put like all the different letters in the wrong combination, forgive me. So there are definitely women who experience ADHD, but the reason why women and girls are being so severely undiagnosed with ADD is because we have to reduce that stigma, that stereotype of what ADD looks like, unlearn, re-educate, and then implement the proper supports, mental and behavioral, social supports for these girls to, one, be diagnosed properly, treated properly, and then succeed properly. This is so important to me is because I was that girl. I am that girl. I am 30 years old as we speak right now. 30 years old, and just last year in 2021 was I formally diagnosed with attention deficit disorder. This is something that I knew from, I would say, back in college, but I had the stigma and I applied it to myself, the stereotype, and I applied it to myself. I was very aware and knew that something was wrong. And again, I'm just in college for my bachelor's. And so, of course, I'm not a diagnoser, but I knew what it was. But I did not go and seek help because of the school that I went to. And the climate that we were in. ADD, ADHD at the time was a diagnosis that people went through great, or actually very little hoops and loops in order to be assisted with medication. And I knew that if I went to that doctor as a young Black girl at college, university, struggling academically, struggling socially, I was not going to get the care that I needed. I went my entire life into my late 20s where I actually went and started to seek the help that I needed. And by that time, I had already experienced the effects, the severe ramifications of having undiagnosed and untreated ADD in my life. To say the absolute least, my life was in shambles. And even at that point, I was not able to conceptualize that this was actually a thing for me. And I went a few more years after that, continuing with inadequate treatment plan until I was not on one at all. And it came to a point where I knew that I could no longer live like this. And when I finally, in my 30s, went through the process, which was entirely long and painstaking and so discouraging at times, I was misdiagnosed and therefore mistreated with the wrong treatment, the wrong medication. And then finally found a doctor that was very, very, very understanding and went through, just really held my hand through the process. And the process for me looked like trying all the million of different types of medications for ADD and ADHD until I was able to find the proper medication for myself. And then when I found the right medication for myself, I ended up at a job where the health insurance did not cover what I needed. And so then I found myself back at square one. And that is why this exists. It's something that I've always wanted to do, but I didn't have all the pieces that I thought I needed. And for me, the piece that I needed was to be mad, to be angry and upset that I went through this entire process just to have it taken away from me again. And I know, even if I don't know, that there are people who are experiencing and have experienced and will experience the same thing that I went through. And the hope is that we stop that from happening. So again, when we look at the demographics, women 26 to 36 are the fastest growing population being diagnosed with ADD and ADHD. And that's because there's a large lack of information, scientific information and knowledge as it relates to ADD with women, as well as public understanding and public awareness, and of course, resources. And when we start using the words deficit and disorder, of course, there's always a negative connotation to that, but there's something missing. But I really want to take the time to make sure that we know that there may be struggles, there may be things that really hinder us and make life challenging for us, women with ADD and girls with ADD. But there's power in it as well. For me, it's where my genius comes from. It's where part of my creativity comes from. So many of the awesome parts of me, I can attribute to ADD, and the BADDIE Collective is one of reclamation of power. It's one for us to change the narrative that Yes, we may have attention deficit disorder, attention deficit hyperactive disorder, but it is, again, our kryptonite, but also co-occurring superpower. That's why the BIPOC, ADD, BADDIE exist, is to change the narrative. And by changing the narrative, we decrease stigma, we increase awareness, and then we close the gaps. We close the disparities in health equity, so that no girl that has ever felt like me, or who looks like me, or can see any piece of themselves in me, does not have to go through what I went through. And so remember, the mantra for the collective is that you can either be bad with ADD, or, hold on, let me fix myself up. I can put the glasses on for this. Or you can be a baddie. Till next time.